Welcome back to Community Connections, and we are here this afternoon here with Sarah Finkelstein, and she is a Medicare specialist and an independent insurance advisor that helps you to figure out when you're aging into Medicare how to decipher which program to get into. And I'm going to actually leave it up to her to kind of describe that, but if you are listening, you can watch us live on Facebook at Community Connections with Norma G, as well as you can call in if you have any questions for her at 888-565-1470, or listen to us at 95.3 FM or 1470 AM on your iHeart app at 1470 AM WNN. And so, Sarah, I want to thank you so much for taking the time to come in today. And
thank you. Thank you so much. I appreciate the opportunity to be here and share some great information with the public.
Yes, I'm super glad about it. And the name of your company is My Medicare Supplements for You.
Right. That is the umbrella underneath Signature Advisory Group.
Okay, Signature Advisory Group. And so tell me a little bit about when people call you and why do they call you and how you can help them.
Absolutely. Great question. Basically, baby boomers are turning 65 at the rate of 10,000 every single day. So it is a huge population. And what ends up happening is they get bombarded with literature and phone calls from people, total strangers that they don't know. And it tends to be very, very overwhelming and may even be confusing. So what I do is I educate them about Medicare, original Medicare, which consists of 4 parts, parts A, B, C, and D, what it covers, what it doesn't cover, so that they can make a wise decision. Because under original Medicare, there are tremendous gaps.
Under what? Okay, so what is A, B, C, and D?
So Medicare Part A is hospital insurance. Covers hospice care, some home health care, and skilled nursing facility.
Okay.
Medicare Part B is doctor visits, preventative services, and basically everything that happens outside of the hospital.
And outpatient rehabilitation.
Correct. Absolutely. And then Medicare Part C is the Medicare Advantage plans, and Medicare Part D is the drug plan.
Okay.
So people can get a drug plan as a standalone or within a Medicare Advantage plan. So original Medicare has gaps.
So for someone like myself who is an occupational therapist, people go to the hospital, they break their hip, that's under Medicare A. Then they get transferred into a rehab, that's under Medicare A.
Correct.
And you can, depending on the need, you go up to about 100 days.
Correct.
Potentially. And then if you're at, even if it's before that, you go home and you get the home health, and that's still under Medicare A. And then you get your outpatient, you're still recovering from your hip, that's Medicare B. If someone stays in a nursing home, I know after the 100 days, that turns into the Medicare B. Sometimes, or Medicaid, depends.
Well, yes, but also under the nursing home is really just 100 days.
Well, I'm saying if someone stays long-term care. When someone takes long-term, long-term care, they pay privately.
Correct.
But if they need rehabilitation inside the facility, we sometimes pick up that patient under Medicare B. Almost like even though they're there, we pick them up as an outpatient. Like if they need a splint or maybe they fall or they get a little weak, we pick them up under Part B.
But a lot of people don't realize that Medicare does not pay for long-term care.
Not long term.
Exactly,
That's correct. That's true. 100%.
That's right.
Yes,
that's
I'm just saying that we can provide service to them as a therapist. We can provide their service to them under Medicare Part B for like a short-term type of boost or something. So then what is Medicare C, the Advantage? Is that where it gets confusing?
Yeah, kind of. What happens is to protect their out-of-pocket exposure, because under Medicare Part A, the hospital deductible is $1,316. And that could happen if they need to go into the hospital multiple times during the year. They'd be responsible for that each and every time that they're admitted into the hospital. So that's the gap within Medicare. Medicare Advantage plan is one way to protect your out-of-pocket exposure under Medicare. And the other way is through a Medicare supplement plan. So Medicare Advantage plan is a network-based plan and a calendar year plan. Whereas a Medicare supplement plan works hand in hand with original Medicare, so that they can go to any doctor, any provider, any hospital across the nation. And depending upon the Medicare supplement plan that they select, that could pay up to 100% of all of their Part A and Part B deductibles, co-pays, and co-insurance. So Medicare Advantage is one way to protect their out-of-pocket exposure. Medicare supplement is the other way to protect their out-of-pocket exposure.
And is the Medicare C, is that kind of like an HMO?
It could be
option?
an HMO, it could be a PPO. The nice thing about a Medicare supplement is they have full control and flexibility. They can go to anybody. There are no restrictions. So any doctor that accepts Medicare, they can get treated by. And they can go anywhere in the country. So that's a nice thing. The other thing that is really a wonderful thing about the Medicare supplement plans is once they have it, they can keep it forever. Mm-hmm. It's an insurance contract. Mm-hmm. So it's written in stone. The companies cannot change those plans.
So when someone gets on Medicare and they choose a supplement, whoever it is, what does that cost on average? Is it different rates for different people?
It depends on age. It depends on zip code. Here in Florida, we pay more than other states, like in the Midwest. I've had clients that moved to other states, and they ended up spending 40% less for the very same coverage. The other thing about the Medicare supplement plans is that they are standardized. So meaning Medicare supplement plan F is identical to another Medicare supplement plan F, regardless of who the carrier is. So it's the very, very same thing. It's
different in different states.
I'm sorry?
It's different in different states? Is that what you're saying?
No, it's the same.
Oh, I see.
It's identical. It's standardized.
Okay.
So there's nothing to compare other than what they're paying in premiums and, of course, the carrier and what their rate increases are.
And I know that sometimes, because I see patients that I always have to check whether they're under Medicare or whether they're under a commercial insurance or an HMO or something like that, because they've opted not to choose traditional, original Medicare. And is that because their monthly fees are lower? Is that why someone's picking that?
It could be, or it could be because their doctor is participating in that particular plan. But people who want the full control and flexibility of going to any physician will typically pick a Medicare supplement plan. And they know exactly what they're paying in premiums every single month, so there are no surprises. Whereas with a Medicare Advantage plan, depending upon their health situation, they may have some surprises.
Okay. And so when you start if I'm 64 years old and I start getting all these emails or start getting all these flyers in the mail, is it something where kind of like I'm thinking in my head, like you call Blue Cross and Blue Shield and you get on the phone with some agent and they start to give you plans and options? So is that something that the government offers? Or is that something where they do offer that, but it's very complicated? We're going with someone like yourself can help kind of streamline and make that a little bit easier.
Yeah, what I do as an independent licensed agent is I walk them through the whole process. What is Medicare Part A in tremendous detail?
Sure.
Part A, Part B, Part C, Part D, how it works, what is covered, what is not covered, how to protect your out-of-pocket exposure, what the differences are between the various supplement plans, so that they can make an intelligent choice.
And is it automatic when you turn 65, or it's something you have to enroll in?
It depends. Sometimes it is automatic and sometimes it's not. So, for example, if somebody is already collecting Social Security, they will get their Medicare ID card sent to them 3 months before their 65th birthday. If they're not collecting Social Security or wanting to delay collecting Social Security, they do need to apply for it. So it will not be automatic for those individuals.
And what about dental?
Dental is not covered under original Medicare, but there are really wonderful, very comprehensive dental discount plans that have no waiting period, no deductibles, no maximum coverages, different than a dental insurance plan. So there are other ways to handle those items that original Medicare does not cover.
How did you get into all this, Sarah?
I've been in the insurance industry for 21 years, and I've had people ask me about Medicare because they're aging into it. So the baby boomer generation are those individuals that were born between the years of 1946 and 1964. That's the 10,000 people every day that are turning 65 that need guidance. They need help because they're overwhelmed.
They're overwhelmed by it. Is that what you find as most people?
Yes.
It is a little bit overwhelming because I've recently had to deal with some insurance stuff, and it is confusing.
Yes,
and
it can be
especially
very
when
confusing.
So do you meet with people one-on-one in their home? Or do you meet at a coffee shop, or is
what
it all?
I do
what
is
are you trying?
I have satellite offices in Boca and Palm Beach counties.
Oh, okay.
So
you
I
meet
meet
there.
with them
Okay.
at
Good.
those locations,
Good.
wherever it's closer to their home.
Sure.
And just spend a good hour to an hour and a half explaining Medicare and what they need to know to be prepared. And as an independent agent, I'm not tied to any one particular insurance company or any one particular type of Medicare plan. I try to help them figure what is the best for their situation and their budget.
And I forgot what I was going to say. So when how do your services work? Is it something where you just kind of can have a one-time consultation with them, or is it something you need multiple consultations? How do you normally develop that relationship with somebody?
Depends on the individual. If it's strictly Medicare that they need help with, it might be 1 or 2 consultations. The service is free. There's no cost to them. So basically, even though they can call any insurance company and get themselves signed up, doesn't cost them any more to have an agent to help them and keep them informed and up to date on changes to Medicare. And one of the things that I find with the baby boomer generation and people living longer than ever before is that most are not planning for long-term care. And Medicare does not pay for that. Medicare pays for some home health care, but it's not custodial care, which is what most people need when they need long-term care. So that's one of the pieces of the puzzle that I also help them with and educate them with.
And so that you kind of do that as well, as you can help them with the long-term care planning, which is, I know, extremely important because I've had a couple attorneys in here or representatives from attorneys' offices regarding elder care and planning, and it's very, very important to position yourself for that. So that so that you preserve your assets, so that it'll be there for you more than with people living longer and people like the Dr. Abdullah that was just in here. The advancements in medicine that people are. She said at the end, there is hope. That there is hope sometimes with these procedures because the doctors are learning more, the research, and less recovery time, less complications. And so we may live longer, and so we're going to need that long-term care planning.
Yes. And one long-term care claim for most Americans could wipe out everything that they've worked for, that they've saved for their golden years.
And also, it's the difference between losing everything because eventually you may just need total care, but where do you have that total care, at least at a place of your choice or at least in your own home, or rather than you being kind of the system telling you what you qualify for versus the other way around. Where, that's interesting that you combine that as well because you bring up that subject, which is important.
It is very
that a lot of people don't want to think about.
The statistics are very high. I don't know if you know what they are, but it's 2 out of 3 people over 65 will need long-term care at some point. So it's really 70% of the population over 65 will need long-term care.
Wow.
And so it's very high risk.
Yes, it is. Well, it's like as a therapist that works in a long-term care facility, a rehabilitation facility, I see it. I mean, it's a small population of people compared to the grand population of people. But when you see people, you can tell the difference between when people have something planned or not. Everyone eventually adapts to whatever scenario they're in. But certainly when people have control a little bit more, it gives them a little more peace.
Peace of mind.
A little more peace of mind.
Absolutely.
They're not so stressed out and worried.
Right. Yeah, I bought my policy when I was 40. And it gives me
read that. I'm like, oh my gosh, I'm already behind the 8 ball. So, all right. Well, Sarah, if someone wanted to find you, thank you so much for sharing this information.
Absolutely.
If someone wanted to get into it deeper with you and sit with you and meet you at one of your satellite offices, what's your website and phone number?
Certainly. The website is www.mymedicaresupplementsforyou.com. The phone number locally is 561-302-5760. And toll-free, the number is 844-453-1419.
Well, she's a pro. She's done radio before a little bit. So thank you so much for sharing that information. I do think it's important because sometimes, we always think about way past, what people need help way past into their 70s, 80s. But this is an important decision that as everyone approaches 64, 65.
Absolutely.
And it's nice to sit down with someone that kind of knows the ropes. So thank you, Sarah, for coming in and sharing that with us.
Thank you so much for having me.
And I also want to thank Whitehall Boca as our primary sponsor of the show for the skilled nursing and rehab facility for helping bring Sarah in here for us today. So thank you so much, Sarah.
Thank you.
We'll be right back with Cindy Broom, our social media specialist, who's going to be talking to us about optimizing your company and branding your company to get to bring people, onto your website and into have your phone ring and get people to call you and stuff.
That's what we want.
Yes, we're going to learn all about that because she's a specialist in that. So yes, that's what we want, right?
Yeah, absolutely.
So awesome. We'll be right back.